My name is Nikki Rutherford. 3 years ago, my son Colin was diagnosed with cystic fibrosis.
I am Lance Smith, and my wife Carmen and I are the parents of a son, Crosby, who's diagnosed with CF.
I'm Jennifer Rigsby.
And I'm Jeremy Rigsby, and our son Alex has cystic fibrosis.
We first learned about Crosby's positive CF test from our PCP. We went in for his third weight check in a little over 2 weeks, and while we were there, our PCP had told us about the positive marker from his newborn screening. Shortly after our visit with our PCP, we received a call from Children's, and they set up our CF test the following morning.
After Colin tested positive for cystic fibrosis on his sweat test, we were able to go down and see pulmonary. We all gathered into a big room and met with his entire CF team, which included doctors, nurses, social workers, and respiratory therapists. Everyone did their best to make us feel comfortable and give us the knowledge that we would need to take what they taught us home and take care of our kid.
So when I got that phone call letting us know about the failed screening, I felt blindsided. You know, we had gone home, and even though I knew the newborn screening existed, I had kind of mentally told myself, well, everything's good, we're home, we're in the clear, I have a healthy baby, and we're gonna move forward. And when I got that call, I was certainly not expected. We have no family history of cystic fibrosis. We had no reason to suspect there was a problem, so we were definitely shocked.
We were actually ready to get to Arkansas Children's Hospital and get answers, and we were relieved actually to get the diagnosis, as sad as it was, because we knew something was wrong the whole time. Like after he was born, we knew that there was something wrong. And so to actually get a diagnosis, it felt like a relief, like we were gonna be able to fix him. So we knew we wanted to be here and get the tools that we would need to just make his life easier and ours.
When we first learned about Crosby's positive CF test, there were a lot of questions. There was some heartbreak finding out that your newborn child, your little baby, is not perfect like you had imagined. But there was also some relief in the fact that we'd been nursing quite often, and he wasn't getting full. We were changing a lot of diapers, and we just couldn't understand why we were having so much difficulty nursing over and over and constantly, and there never was any relief on his side of seeming full. So this was some closure to say that it wasn't something on our end that we were doing wrong. It was something with him, and this diagnosis was confirmation that you know, we were okay as parents and doing what we were supposed to do.
Once we received the diagnosis of cystic fibrosis from the sweat test, it wasn't just a, well, here you go, we're gonna send you home. It was really hard and overwhelming, but also amazing. So there were a team of specialists at the hospital, pulmonology, genetics, cystic fibrosis specialists who had pretty much set aside their afternoon for us, is how it felt to me. So we were able to stay to meet with the doctor who would be our doctor, to meet with the coordinator of the cystic fibrosis program, to watch a video about what CF was and what it meant, to get our questions answered and some of our fears eased, instructions on, here's what you can go home and start doing right now.
After meeting with the geneticist, we went to pulmonary, and we got to meet our doctor and our social worker and our respiratory therapist and our nutritionist, and basically we just met our entire team.
Our experience on first meeting with our local CF team here at Children's was a good one. Even though we've met them on that very long day, it was nice to know that he had a very particular set of doctors, nurses, respiratory therapists that were really catered to him and his needs and us as a family. We've gotten to know them throughout the months of visits every month, and we feel like they've gotten to know us. They're very open to any questions that we've had. They also don't mind answering the number of questions that we've had. And they've been very patient with explaining the process with us and how to go about recognizing differences or how to communicate with them some of these differences we're seeing in his development and his growth as a little boy. Our initial understanding of the diagnosis from the beginning really started with more questions than answers. We sat down with our geneticist at Children's and she explained the genetic side of the disease. She also was quick to make us aware that CF is a very broad spectrum disease. Not every child is affected the same as another child. So she wanted to caution us to Google what CF might be or go somewhere else and do that. She wanted us to reserve to learn for ourselves and be in with our child. Like what are his symptoms? What does he feel about the disease? How is he responding to treatments and medications? So we grew to learn our child's spectrum of the disease and monitor it on a daily basis. And we also grew to learn that his is a lot different than a lot of the other kids. We take his day by day with his medications. How does he feel? And we're still learning daily. All of our clinic visits, we learn a little bit something extra from our doctors and our nutritionists. There's just every day, there's more information coming forward for us that we're trying to apply to his daily life.
So there have been many resources that have been helpful to us as parents, and there's been a lot of support and accessibility to our team and even to other parents. So all of that's been helpful. Specifically, we were sent home on our day of diagnosis with a packet of information. Some of that was generated by medical personnel. Some of it was generated by parents. You know, hey, we've walked in your shoes and here's what's been helpful for us. And that was really nice to go home with a little bit of both.
Resources that helped us after getting Colin's diagnosis, definitely number one would be the Cystic Fibrosis Foundation. I Googled so much information and it was the worst thing for me. And finally, I talked to our nurse at Arkansas Children's Hospital and she said, quit Googling, go to the Cystic Fibrosis Foundation for any information that you need. And that was really a lifesaver for us.
On the initial diagnosis, of course, we sat down and talked with my wife and I discussed what is CF? What do we know about CF? You know, did we have any family history? And one of the things that Children's communicated to us from the very beginning was don't seek out internet definitions of what CF is. The CF Foundation has a wonderful website with lots of information, lots of videos, even videos tailored to parents with a new diagnosis. That was really helpful for us to get on there and read, to see some success stories, to see some patients who were diagnosed early on and who have lived a full life. That was one of the biggest things that we had for us as parents of a newly diagnosed child, was to see that this isn't the end all of him, you know. So the information there, the videos, the reading material made it a lot easier for us to approach this disease and this diagnosis in a better light.
One piece of advice that I would give families in our situation is to remember all the things that are still completely normal about your baby, your child, yourself and your family. And the list is going to be much longer than the things that aren't normal. And the list of things that look hopeful and bright and encouraging about your child's future and your family's future is going to be longer than the list of things that are scary.
Just a few words from advice from a parent who's been through the new diagnosis and the newborn screening process is, you know, you need to try to take it all in stride and understand that this is what it is. You know, you can react in several different ways, but you need to understand that you need to be there for your child. You need to stay positive for your child, because even though they're diagnosed early on, this is all they're going to know. So it won't be different to them than other kids who are growing up. This is going to be their normal. They're going to know that they have to take enzymes. They're going to know that they have to take respiratory treatments. They're going to know they have these medications. And the sooner they learn that, and the sooner you stay on a strict schedule with it, they're going to know that this is their normal life. It's easy to get wrapped up in the diagnosis and the things that may happen or could happen in the future, and you end up missing a lot of the things that are going on now. As a 15-day-old baby, you miss some of the baby noises or the moving of the fingers or the wiggling or all these things that you forget are going on right now because you're too busy projecting things that aren't a certainty on your child's future. So just be very patient and make sure you're in the now and not in the future with your child.
It is important to know that the newborn screening is a really great thing. It keeps you from being misdiagnosed for years. It can save your child's life. It did save Colin's life.